Let's talk a little bit about that. So what happened, Eamonn, in 2020? What happened to, obviously, the pandemic, but what happened to your company?
Yeah, so I suppose, we were in Ireland, we were already active in kind of the UK and the US, and in Ireland, we were starting to get traction, in particular, the aims of the SláinteCare kind of reconfiguration of our healthcare. Like a lot of the aims are really positive. So it's about moving care much more into the community, into the home where possible. Very much in keeping with kind of our mission and what we do. So we were working on those sort of areas, pre-COVID. And then, I think when we were all starting to see the pictures coming from Italy, we knew COVID was getting closer to ourselves. So we started, really kind of looking at our existing solution. We were working in lung disease. We knew, and we'd worked with a lot of the leading lung disease doctors in Ireland. So we thought about how could our solution be reconfigured to help the hospitals meet the expected surge. So we just basically adapted our solution. We already had integrated, and we had supplies of pulse oximeters to measure the oxygen levels of patients. So we went live in early to mid-March with that, and it really kind of, both the hospitals, the clinicians and the patients have found it remarkably useful in, helping keep patients out of the hospital, discharge patients early. It's allowed them to effectively have more capacity in their hospitals. So, just kind of, was it last week, kind of the Clareburn live show came from outside the Mater hospital, or maybe it was 2 weeks ago now.
Yeah.
They mentioned, that they had 160 COVID patients, half in the hospital, half at home, and that at home was being managed, with our platform, our service.
Very
and that's
good.
Repeated by hospitals throughout the country. And just in the last 2 weeks now, we've gone live with general practices as well. So GPs around the country are now prescribing this as well. I suppose in parallel to all of this, the other thing that we've been very active on is, the chronic disease patients, what's happening to them. So, we've been rolling out solutions for cystic fibrosis, pulmonary fibrosis, asthma, COPD, lung transplant. And that's replicated, in the UK and the US, and we've plans to kind of launch into European markets with that this year as well.